everyone. My name is Meredith Preuss, and I'm the Executive Director of the Gordon and Marion Smith Foundation. Before we get started, I would like to acknowledge that we are on the Squamish and the Tsleil-Waututh unceded territorial lands. We are grateful for the opportunity to learn and converse and experience art on this beautiful land. Thank you all for coming today. This is the last talk in a 5-part speaker series, Art Education for Life. The series brought together voices from diverse fields, each sharing how art education has profoundly shaped their professional and personal journeys. Today's talk features Dr. Maiya Geddes and Dr. Randy McIntosh, exploring the intricate relationship between art and neuroscience. In this discussion, the two will converse on the neural mechanisms shaping creativity and aesthetic experience, exploring artistic expression and cognitive processes, and probably much more. I want to thank the O'Dane Foundation for their support, Polygon Homes and Anthem Properties, as well as the North Vancouver Recreation and Culture Commission and the North Vancouver School District, and our partner organization, Artists for Kids. I'm going to introduce our speakers. We have, who many of you know, I realized, as we were all mingling together. More of you know them than you know me, which is rare for our talks. So Maiya Geddes is a neurologist scientist at McGill University and the director of the Cognitive Neurology Clinical Fellowship Program. Dr. Geddes leads a research program and lab at the Montreal Neurological Institute that's focused on understanding motivational processes in aging and early Alzheimer's disease using cutting-edge cognitive neuroscience and brain imaging techniques. She applies this new knowledge to design intervention studies and behavioral randomized controlled trials with the ultimate goal of dementia prevention. Dr. Geddes completed medical school at UBC, a residency in neurology at McGill, followed by a 6-year Canadian Institute of Health Research postdoctoral fellowship at MIT, and a second fellowship in behavioral neurology and neuropsychiatry at Harvard. I think you need to go back to school. Yeah, holy smokes. After her fellowship, she joined the faculty at Harvard before returning to McGill in 2019. Dr. Geddes is a Killam Scholar. She's also the recipient of the 2024 Brain Canada Future Leaders Award and the 2023 Alzheimer's Society Research Program New Investigators Award, and the American Neuropsychiatric Association Career Development Award. Now, Randy is no schlub either. Randy McIntosh holds a PhD in psychology and neuroscience with a strong background in statistics. His research journey began at the Rotman Research Institute, University of Toronto, where he developed a keen interest in understanding aging and cognition. Randy is the co-lead for a team that created The Virtual Brain, thevirtualbrain.org, a groundbreaking platform that unites global research efforts. Randy recently joined Simon Fraser University, where he's establishing a new institute for neuroscience and neurotechnology. This is sure to be an interesting talk. I will take no more of your time and pass you on to the speakers. Thank you.
Well, it's an absolute pleasure to be here. Thank you so much, Meredith. I'm going to be talking about my own journey in neuroscience, medicine, and art. My name is Maiya Geddes, and I'm delighted to be here. And seeing so many people that I love in the audience is a huge bonus, too. So I don't have any disclosures, and this talk is quite broad in its scope, but quite short in its timing. And we're going to talk about 3 different themes: art, neuroscience, and neurology. And you can see pictured here at the bottom is a Gauguin painting called Where Do We Come From, What Are We, and Where Are We Going? So let's start by diving into the first theme. So art and science are complementary languages, and they help us with expression, exploration, creativity, and their intersection with medicine and with neuroscience has been a passion of mine for many, many years. And when I was asked to give this talk by Meredith, I was transported back to my 14-year-old self, having just moved to Vancouver from Melbourne, Australia, where I was excited to be given a summer scholarship to go to the Artists for Kids program. And this is actually the smock that I wore during that summer as a 14-year-old, which I still use when I make art. And during the summer, I was mentored by the renowned Canadian artist Guido Molinari, whose forms, guidance, and presence were inspiring, and he provided great mentorship. And he was also a very patient and generous man. So you can see him here. He actually sat for me as I painted his portrait. And so this is Guido Molinari pictured in an underwater seascape with his paintings as fish swimming behind him. And shortly after the Artists for Kids program, I made this sculpture called The Researcher, which would foreshadow my future in research. Reason, wonder, and doubt remain my only clue to a world hardly real and as thin as air. And this piece was made out of plaster of Paris, the same plaster of Paris used to set broken bones, wire, and clay. And you can see the researcher pulling the earth in a cart behind them in search of the internal question, just out of reach, but allowing us to move forward. And as scientists know, one question begets the next. And then as I started as a medical student, each organ system that I learned about, I tried to convey the topic using the visual form. And so here is the heart system, the cardiovascular system, in a piece called Heart Sounds. And so you can see the heart here as a cello transformed with chordae tendineae as its strings. And I made a replica Leonardo da Vinci heart painting in the top right with a sculpture of my ear underneath and a piece of music under that. And overhead, there's an inscription by Sir Walter Scott: "We shall never learn to feel and respect our real calling and destiny unless we have taught ourselves to consider everything as moonshine compared to the education of the heart." And in medicine, our ear is an incredibly valuable diagnostic tool. It allows us to auscultate or listen to heart sounds, but we also listen to the plight of the patient. And listening is one of the few things we do in medicine, the few acts that can cause no harm. And in the words of William Osler, listen to the patient, they are telling you the diagnosis. And here you can see the image of a piece of music with an EKG overlaid on top with prestissimo or tachycardia. And concurrent with my medical training, I took graduate course studio work in fine arts. And this is a piece that I made at the Banff Center for the Arts during an artist residency called On the Fabric of the Human Brain. So you can see a large wood block print on the top left of the spinothalamic tract, and on the right, there's the vertebral column with the pupillary light reflex pathway painted in oil in the middle. And the title refers to a monograph by Andreas Vesalius that was made in 1543 called On the Fabric of the Human Body. And I was inspired to make this piece when I was traveling. I found a book of untranslatable words. And I found my name in this book, Maiya, which signifies coming out of the illusion of confusing the symbol for the reality that it represents. And similarly, as a neuroscientist, in our sometimes reductionist quest to understand the form and function of the human brain, it's important not to confuse the anatomical map with the reality underlying it. This is a piece that was funded by the MIT Council for the Arts and that appeared on the cover of a journal, Neurology, that sought to ask the question that's central to memory research, which is what is remembered and why. So memory is not merely a transcription of events, rather it's a constructive process that's influenced by our state, our motivation, and our goals. So memories are not snapshots of our catalogs of past events, and because of this, they're susceptible to distortion. So this sculpture, Memory and Mechanism, depicts the neuroanatomical underpinnings of memory as a hollowed anthropomorphic mahogany sideboard is cut open, and the top is reflected upward. And if you peer into this sculpture that is supposed to represent memory, you can see, like a craniotomy, a silicon cast depicting blood vessels and dura lining the cover of the sideboard. And in the center there are piano hammers and clocks representing, and we just had a conversation about this with someone in the audience, time and place cells within the hippocampus, important for forming memory. On the left, you can see hands at a piano, or procedural memory, and episodic memory depicted on the right, my sister at the piano. And you can see this piece contains 20 layers of painted plexiglass, and depending on the viewing angle, the brushstrokes coalesce into figurative imagery or appear distorted, a representation of the susceptibility of memory to distortion, because they are not cataloged snapshots and are influenced by our internal states. So using tools like resting state functional magnetic resonance imaging, or MRI, we can see at rest secrets about how the brain is organized using spontaneous fluctuations in blood in functionally related brain regions that correlate with one another. And these patterns of correlation reveal secrets about the intrinsic functional connectivity of the brain. They persist in anesthesia, undergo predictable changes during development and aging, as well as disease. And so this was a piece that I actually made with the School of Theater at MIT, and we published it in a book called Infinite Record, Archive, Memory, and Performance, where we tried to depict two reciprocal networks, the default mode network and the salience network, with text borrowed, so self-referential processing from the default we used, Frankenstein, memory, we used Proust, Thomas Hardy was representing the salience network and autonomic arousal. And the performers actually performed sort of a reciprocal depiction of what neural networks might look like. And meanwhile, almost at the same time, but in a different country, Randy McIntosh made My Virtual Dream. And this was an immersive art installation at Nuit Blanche in Toronto. And it was a piece that was put together with 20 participants at a time who interacted with the virtual brain that we just heard about using a Muse headset or a wireless EEG. And different brain states were able to have sort of the effect of a group dreaming process almost. So this was an educational and immersive experience about the brain at the intersection of science, art, music, and technology, where participants became performers using their own brainwaves to co-create a performance with visuals, sound, and music all projected overhead. And here you can see the musicians being inspired by the sort of transient dream states, or the states within the participants, and actually improvising as they went. So now let's dive into my quest in neuroscience. So we're going to sort of switch gears a little bit here. So when I walk into my institute, the Montreal Neurological Institute, in the foyer, when you gaze up at the ceiling, there's this gilded image, which you can see on the right here. And it's Aries, the astrological sign that presides over the brain, surrounded by 4 pictographs that come from the Edwin Smith papyrus, which is on the left. And these images are of a vulture, folded linen, effluent, and a flowering reed, which are the oldest known representations of the human brain in writing. And the creator of the Montreal Neurological Institute, Penfield, was inspired by this quote from Galen: "I have seen the wounded brain heal." And Galen's observation highlights that we're not shackled to our neurological fates. The vulnerable brain can be protected, and as neurologists and scientists, we're always working with a margin that is vulnerable, but it's salvageable. And the application of this notion, or the notion of penumbra, of vulnerable yet resilient aging brain, is what guides my research in dementia prevention. And why dementia prevention? Well, we know that this is information from the Canadian Longitudinal Study of Aging, that almost 50% of dementia cases could be delayed or prevented by changing or optimizing modifiable risk factors like social isolation, smoking cessation, or physical activity. So I'm going to just show 3 studies from my lab this year where we try and understand brain behavioral relationships between lifestyle and its bidirectional impact on the brain, how lifestyle impacts the brain, and then how brain guides behavior. So in this first study, we asked the question, how does lifestyle and behavior impact our brains? And Maiya Geddes, who just started her postdoctoral fellowship at Stanford this fall, looked at 139 cognitively unimpaired older adults who are at risk for Alzheimer's disease, and their behavior across physical activity, social engagement, healthy dietary choices, and cognitive activity. And we used machine learning to try and use the brain as a tool to classify individuals into either adherent or non-adherent lifestyle behaviors. And we did a pretty good job in terms of the classification analysis. We found that riskier lifestyles were associated with increased network connectivity between networks, so brains tended to be more segregated in their organization, and older adults engaged in these behaviors across all 4 domains in conjunction rather than in isolation. So people who tended to do one of these behaviors did all 4. And we found that that was associated with personality, differences in cognitive decline, and differences in motivation. Then we also looked at the flip side of this question. Can we use the brain as a crystal ball to predict how people might change their behavior over time? So is there a brain fingerprint that predicts successful smoking reduction, for example? And we chose smoking because it's one of the most important and prevalent risk factors for dementia worldwide, right after hearing loss and low educational attainment. But we don't understand how or why adult smokers change their behavior or maintain change. So a PhD student in my lab, Nagatho Vinakari, used open science principles to have a discovery study and a replication study looking at older adults who were smokers over a period of 3 years to understand their smoking behavior and see if we could use the brain as a crystal ball to predict who was going to successfully change. And we focused on a part of the brain called the insula, which is really important for introspective states. It's an interesting area of the brain because if you have a stroke in this region, you can actually lose the desire to smoke cigarettes, and you can have abrupt smoking cessation. So we wanted to understand why that was. And we found that the relationship between the insula, its connectivity with a part of the frontal cortex called the ventromedial prefrontal cortex, could help us predict who was going to change their behavior, potentially acting then as a biomarker for smoking cessation. And this is a study that we submitted last week. So this is extending that finding to understand contextual and brain contributors to successful physical activity engagement. And here we looked at 300 individuals who are older adults. They were inactive older adults, and they had a new diagnosis of a heart attack, angina, they had diabetes, high blood pressure, or increased cholesterol. And we wanted to know at this kind of teachable moment in life, or this critical window, who was going to change their physical activity engagement. So we, again, used the brain and behavior across social determinants of health, and again, used machine learning. And we found that access to green space, social support, retirement status, goal-directed cognitive function or executive function, as well as cross-network connectivity in different parts of the brain, predicted who was going to engage in physical activity. So together with some colleagues at McGill and a large grant from Healthy Brains, Healthy Lives, we founded the Cognitive Neuroscience Knowledge Exchange for Clinical Translation. So together with my colleagues, we're asking the question, how might we make cognitive neuroscience more applicable to the real world? And here's a project from that initiative run by a grad student in my lab, as well as a med student and a thesis undergrad, where we're trying to tackle the question of how we can have more representative sampling in research. Because if we don't have representative sampling and our sampling is biased, we can't generalize what we find. So we used participatory methods where research participants actually co-designed the results that we found using a process called fuzzy cognitive mapping. And we were able to identify barriers and facilitators to participation in research. So my lab takes all of this information about behavior change, about social motivation, motivational processes, strategies to improve representation, and we design intervention studies. So this is an intervention study called the Healthy Aging Brain Study, or HABS for short. We were borrowing from the Montreal hockey team. We are just analyzing this data, and this trial actually met efficacy. So this was an intergenerational study in older adults at risk for Alzheimer's disease, funded by the NIH. Now let's switch gears one last time to focus on behavioral neurology, or a little bit of a view into medicine. So as Osler said, to study the phenomenon of disease without books is to sail an uncharted sea, while to study books without patients is not to go to sea at all. So this is the relationship between science and medicine, where both are really integral and a part of each other. So I want to show 3 different patient examples. They're not my patients, but ones that were described in the literature. And this will describe the impact of neurological illness on art making and creativity. So one of the questions in neurology is about regional specificity. Why do, for example, myopathies or muscle diseases affect certain muscle types and not others? Or in neurodegenerative disease, certain brain networks are impacted more than others. And you can understand this kind of like a cascading failure in a complex system. So it's a domino effect similar to what's described in a power failure. So neurodegenerative disorders target specific brain networks. And one example of this is Alzheimer's disease targeting the network called the default mode network, a network that's important for remembering the past and imagining the future. And here you can actually see the default mode network pictured this is a colleague of mine at MIT, Rebecca Sachs, who went into the scanner with her infant son, and you can see parts of her medial prefrontal cortex and posterior cingulate cortex, a little bit of visual system there too, as she's probably gazing at her son. And this default mode network is important for introspection, memory retrieval, visual imagery, daydreaming, and imagination. And it exhibits functional and structural connectivity, but it's disrupted both in aging and even more profoundly in Alzheimer's disease. So here's an example of a patient suffering from Alzheimer's disease, William Altermolen, and you can see the effect of the illness on his art making. So in 1995, after he was given the diagnosis, he began to work on an ambitious series of self-portraits. As his wife wrote, from that moment on, he began to try to understand it by painting himself. So forms were simplified and distorted as he lost perceptual abilities, but his ability to convey emotion was relatively intact. So this is the default mode network more at the back of the brain. Now we're moving to the front of the brain where the salience network can be affected in semantic dementia. Semantic dementia is conceptualized as the loss of the name and notion of things. So this is a patient, MH, who's a 77-year-old artist who couldn't draw images when only given the names of the objects. So you can see on the left, if it's told a key or an apple or a book, there's a very simple representation. In contrast, when he was asked to copy an image, this time he was asked to copy an image from Botticelli, he does an amazing job because his perception is intact, but his conceptual processes aren't. So semantic dementia is the loss of the notion of things, where you might ask someone to pass the broccoli and they would ask you, what is broccoli? And semantic dementia was actually described by the protagonist in Gabriel Garcia Marquez's 100 Years of Solitude. He marked everything with its name: table, chair, clock, door, wall, bed, pen. Studying the infinite possibilities of a loss of memory, he realized that the day might come when things would be recognized by their inscriptions, but that no one would remember their use. And here's that patient's brain imaging showing loss of a heteromodal cortex called the temporal pole, and a change in his salience network, again involving the insula, the part of the brain that we talked about earlier, which is important for introspection. And I want to show you one final patient. This is a patient who had primary progressive aphasia and actually lived in Vancouver. Her name is Anne Adams. It's known, and she has written, there's writings about her experience. And so she had a progressive degeneration in the language network, yet she had visual creativity that deepened as her language system deteriorated. And in about 3% of patients with behavioral variant frontotemporal dementia, you can see emergent visual creativity as part of their illness process. And this patient had an intense drive to produce visual art. So this is an example of her artwork before her illness, and you can see she was very interested in architectural drawings with quite muted colors. But as she developed the illness, she had emergent transmodal creativity. So this is a painting she made called Pi, where she depicts each digit with a different color, translating abstract concepts and sensory experience into visual form. And here's her painting ABC Book of Invertebrates, showing her interest in realism and symmetry as she had each letter of the alphabet painted in mandala format and assigned to a different organism. And in sort of a historical twist of fate or a disease-related convergence, Anne Adams became intensely interested in a piece written by the French composer Maurice Ravel called Bolero. And interestingly, Maurice Ravel himself had primary progressive aphasia, the same disease that Anne Adams was suffering from. And if you look at his scores, he actually made spelling errors in the margins. And because he was becoming apraxic in his right arm, he was using his left arm to compose this piece. So it's a very left-hand dominant. And it's an exercise in compulsivity, structure, and perseveration. So this piece has two main melodic themes that repeat in 8 times over 340 bars, and Anne Adams took each and every bar and transformed it into each of these images you see here. So pitch was described with color, volume was described by the level of the line at the bottom. The instrumentation was overlaid with gold and silver paint, and the most interesting note in each bar was described with a geometric form, so a dramatic example of transmodal creativity. So as she was producing this art, you can see that the frontoinsular cortex on the left side is progressively being lost. But in an interesting sort of release phenomenon, she was actually having an increase in both cortical volume and blood flow to the right posterior parietal cortex. So these are examples of the importance of, as we sort of move into sort of big data, there's an importance of deep phenotyping. And so what we can learn from individual patients is incredibly important. And I tell medical learners to keep the exception in your pocket because they're telling you something about the disease. So critical insights can be gleaned from and in service of single patients. And no one exemplifies this better than my academic great-grandmother, who's my supervisor's supervisor, Brenda Milner, who's 105 and working as a neuroscientist at the Montreal Neurological Institute. And the information that she gleaned working with the patient, HM, who had injury to his hippocampus, but that interaction over many, many years has taught us an incredible amount about the neuroscience of memory. So with that, I want to just say thank you to the patients and families who make my research possible, to my wonderful team, my lab, and my collaborators and funders. So let's open this up for discussion. So, and if anyone has any questions, please feel free to jump in. Yeah.
One of the interesting themes that came out is the ability to use art to communicate different aspects of what you're talking about. And I'm wondering if in your interaction with other physicians, whether you've managed to tap into that skill to help them appreciate something that they may not have actually noticed about a patient or noticed about a particular illness, and that sort of helped to come up with a better way of treating that patient, for example.
I mean, I think the power of observation is sort of one of the most beautiful skills in medicine. And so we're always watching people. And I had a conversation just before this talk about watching people walk, like what we can learn just by watching people walk. So the power of observation and the ability to sort of watch carefully is incredibly important. And is an important part of medicine. This idea that medicine really is an art is critical in it, and I think it's important that we don't lose that as we sort of use more and more technology in what we do. So the art of medicine is really incredibly precious. And I find that a lot of physicians gravitate towards music or other artistic pursuits as a form of expression. We also know about narrative medicine, which is the importance of patients telling their stories, so listening to stories, and this idea that the patient and the physician are really on this convergent path where you're sort of walking together with this person and in time and space and sharing their story. So I think that as a form of expression, also as a tool for observation and to kind of glean these pearls, which, you know, as they say, like half of what we teach you in medicine is false. We just don't know which half. It's
a great example. And actually, it's similar in the sense of the importance of art and science in general. I mean, if you talk to a lot of people who are sort of in fundamental research, I don't know if the proportion is higher than would be in the general population, but certainly a lot of my colleagues have artistic skills, whether that be writing or music or sculpting or painting, something of that sort. They have that capacity as well. And it seems it's both a hobby, but it's also a way, I think, of bringing a different perspective to what they're working on. So they might get immersed in this sort of really dry science, but by having that artistic connection, all of a sudden it can be made accessible in a way that may not be if you just read a sort of a generic textbook on the topic. So I think that's quite an important thing to consider, is that by having that artistic background, it gives you an ability to have a perception, a perspective that may not be necessarily inherent to your discipline, but by doing that, you actually have a capacity to communicate much more broadly and engage people in a way you may not have done otherwise.
Yeah, I mean, I think we're sort of appreciating more and more in science this idea of knowledge dissemination. So how do we learn things, but how do we sort of communicate what we know? And science communication is incredibly important. And it can be done in many different modalities, whether it's verbally. I find that art offers sort of an amazing outlet to express ideas in a novel format. And sort of distilling things down into their essence is incredibly important. I mean, we're inundated with data, and we want to take that data and synthesize it into knowledge, ideally synthesizing it into wisdom. And so this is, I think, just another outlet or another tool that helps us kind of reach this distillation of ideas. Does anyone have any questions that they wanted to ask? Or, yeah.
Thank you very much. That's fascinating insight. That photo that hinting of the man with dementia is progression is haunting. Can you comment a little bit on how to strengthen default network and or risk factors against resilience in default networking? Because it seems that that is a driving force of maintaining almost humanness of consciousness, and I'm curious about that.
Yeah, so I think there's a lot of interesting parts of that question. So thanks. So things to strengthen default mode network. So we know that the default mode network is malleable. There have been studies looking at, for example, meditation that show an effect on default mode network functioning. But backing up, probably proximal to that, we know that aging, especially vulnerable aging, and in that person's case, Alzheimer's disease, is what really impacts the default mode network. So it's kind of, the last part of probably something that was grumbling along for many, many decades. So what we can do, we know we have a lot of tools to impact the risk of Alzheimer's disease and dementia, and that happens sort of upstream. And so those are a lot of ways to protect, your cardiovascular health, as well as some of the modifiable risk factors we talked about here today. So social isolation, physical activity, sleep, depression. So all of these are sort of treatable things that we can do to impact your risk of dementia, which will then kind of, similar to the cascading failure, take your default mode network hostage, so to speak. But it is an incredibly important network in sort of some of these essentially human qualities. Yeah.
It is interesting to note that a lot of what we talk about in terms of things that can affect cognitive function are also the same things that are going to affect whether you're resilient in the long term as well. And Maiya mentioned the idea of sort of these modifiable risk factors, which is a really, really important thing to keep in mind. That there are things that you can do that actually will help prevent dementia. You may never even get it. If you have cardiovascular health sort of high, education might be a proxy for something, but at least there's something to do with mental activity. Social isolation is a big one as well. And those are things that we can actually work together to make better. And that's something that you're not going to find a magic bullet that's going to do everything for one person. Every person has their own sort of needs that have to be satisfied. And it's taking into consideration of how do you take that person in mind when you're trying to think about things that will make their lives better going forward, whether it be just maintaining health or preventing dementia or trying to keep it at sort of some modifiable or tolerable level for a longer period of time. That's really an individual thing. But we already know what some of these modifiable risk factors are, and our ability now to actually work to make them better and easier to deal with is something we really have to put a lot of attention on.
And I mean, as physicians know, or any healthcare worker knows, all of this knowledge we have about modifiable risk factors is all very well and good. We know tons about what physical activity does for the brain, but what is really hard to do is to change behavior. And so every single patient I see, I will give counseling about what that individual should be doing, what their risk factors are. But then it's a black box, what happens when they walk out of my office. And so a lot of my research really focuses on trying to understand, what about the individual allows people to actually implement and make those changes, which are really, really hard, as we all know. Yes, Leon.
It's clear that people who exercise or are socially active, who do a variety of other things, are less likely to develop dementia. Putting vascular risk factors aside, what evidence do we have that changing these risk factors actually influences the onset of dementia, as opposed to saying, somebody who's in the early phase of dementia, which are not yet quantifiable, is less likely to exercise, less likely to adhere to good eating habits, less likely to socialize, less likely to take piano lessons. How do you weed out, or how do you separate the two?
Yeah, so Leon's bring up this question of cause versus consequence. How do we know that these different modifiable behaviors are leading, are sort of risk factors for a disease like Alzheimer's disease or dementia, versus are they sort of consequences of having the disease, very, very early symptoms, so disease markers versus risk factors. And probably some of the best data that we have. So a lot of the modifiable risk factor data comes from epidemiology, which is confounded by some of these chicken and egg questions. But we can also do intervention studies. So there's a number of studies that are called the FINGERS trials that were started in Finland, and these are multi-domain intervention studies. So in order to say something about causality, you actually need to manipulate the system. You need to kind of do something to the system and see if that actually changes the system in the way we predicted. So these multi-domain intervention studies showed that cognition could be enhanced and dementia could be delayed. And so probably the randomized control trials that actually seek to modify those behaviors are probably some of our best evidence. There's also some people doing genetic studies to look at whether, if you're wired with these risk factors early, is there any relationship between your ability to engage in behaviors or your risk factor with dementia? But I would say probably the randomized control trials targeting these behaviors are some of the best evidence that we have in terms of causality. Patrick.
I'm afraid we started the classic argument. It went into maybe I'm just doing this to engage, so I don't get all start to be cognitively engaged. No, but I was thinking about your presentation. It was fantastic. I've learned a lot, and it's amazing to see. And I thought you started off grounding your talk in this latest Artists for Kids, and the art you showed behind you started off with a Gauguin from the 19th century, and then I looked at your art, and it seemed very inspired by the early part of the 20th century, expressionism, different types. I imagine, this is me being a psychologist, I'm thinking, probably looking at Kandinsky, you're looking at all kinds of abstraction, actually. And when I think of that, history of that art, as opposed to science, it didn't really come so much from science. And I think that's what's fascinating about your talk, is you're approaching that aesthetic from a scientific point of view, which the avant-garde was always an enemy against. In fact, if you look at the emergence of that kind of art, it came from a search for spirituality. And the spiritual and the scientific, they were always, kind of at odds, right? And so, I thought maybe, I don't know, what do you think of this? I'm interested in that, what you set up for us here in a connection, but they're both searches in a way.
Those are such perceptive observations, interesting questions. Yeah, just wonderful sort of catalysts for thought and reflection. I think that this idea of, science being divorced from spirituality, also being a mother and seeing young people experience the world for the first time with curiosity, the same curiosity that drives scientists, really, is a spiritual experience. Like that discovery is, it is as magical as anything else. It's, seeing the brain, how does it work? Like these are questions that are so essential that they almost do seem somewhat spiritual and transcendent. So I think, just as art seeks a certain of beauty and sort of self-transcendence, so too does science, and so too does good science. It puts things together, it makes things clear, it provides new perspectives. So this idea of attention is really a false one. The idea that, scientists versus artists, or, spiritual versus other, it's all these are all symptoms of the human condition. So because it comes from us, it can be expressed by us in these different media. And I think these are really interesting food for thought. I mean, one of my earliest supervisors, thought, how can you be a scientist? Like, if you were a scientist, you couldn't possibly believe in like the ephemeral or eternal or like spiritual concepts like you've seen it. I don't know if you've read, I haven't read it yet, but the recent Orbital Booker Prize, and it's about two astronauts sort of looking out at looking out at space, and one is spiritual and sees, grand design, so essentially seeing the creation of an art piece, whereas the other, as a scientist, is mystified by the beauty of, the experiment of it all. And both are equally beautiful, just, different ways of looking at it and grounded in the human experience.
About the music and singing, I apply that when we go to nursing homes. We see people that are completely gone, but when we start singing some hymns, they are singing all the words without even reading. I mean, how does...
That is, I actually had a video that I took out of the presentation which was describing exactly what you're referring to. It was a video of a ballerina, and she has advanced neurodegenerative disease, but she hears Swan Lake, and she's in a wheelchair, she's mute, but she actually starts almost to dance with her arms. She's clearly connected to this music. It's an unbelievably beautiful experience. And you're right, music is not just, it's a form of self-expression. It allows sort of a deep connection, probably through the limbic system, to some of our earliest experiences in a very well-represented way. And it's also an incredibly healthy thing for your brain. So we have a study, we didn't talk about it, and I know there's some scientists in the audience actually that study music, but we have a study looking at older adults at risk for Alzheimer's disease and showing that early music exposure influences their visual perceptual abilities, and it influences their cognition in late life as well as their functional connectivity. So it's both incredibly healthy for the brain, probably similar to learning a new language or being bilingual. But as you described, it can be incredibly transcendent. So using music therapy as a tool in individuals who have advanced neurodegenerative disease is incredibly powerful. And when you see these experiences, it's quite impressive. Yeah.
Is it used, let's say, in the institutions where emergency comes?
It is, yeah. There's music therapy, but I'm actually going to turn that question over to Sarah in the back there. Did you want to say a few words about it?
Yes, absolutely. So nice to meet you. I'm Sarah. So music therapy is in kind of larger cities and larger kind of more well-connected programs, absolutely. And so you have a trained person that studies music therapy. They come in and work with people in nursing homes, so both in group and in individuals. So I used to do this work. So as you saw, when you go in and you sing, everyone can kind of get together and do this, and it's wonderful. But we also do a lot of work with people one-on-one. So I had a number of clients who, again, nonverbal, very wheelchair-bound, and even people that had not had a history of musical training. You could give someone a touch-sensitive instrument and just start playing their bodily movements or their cues. So we would kind of set a baseline to a heartbeat, for example, or the rate of breathing. And it was wild how quickly someone realizes that that's what you're doing. So I had a lot of mischievous people who would say, okay, what are you going to do if I do this? Or if I scrunch my face up? And so in that way, we were able to communicate musically. So there's something special about it.
I just want to add something to that. So Sarah and actually I both came from Toronto. We both worked at a teaching hospital in Toronto called Baycrest, which is a long-term care facility. And it did have a lot of programs that really used the creativity of humans to try and support their well-being. That included music, but also art. So they had these fantastic art classes where people would come in of all different kinds of chronicity. Some people who were just sort of had physical problems, some people who had cognitive impairment, but they would always benefit from being involved in that. It's not really clear whether they emerged from something, but they also really enjoyed being in there. That also changed their personality quite a bit, and they were quote unquote happy to be creating again, whether that be creating music creating pottery, creating painting, something of that sort. Some of that was actually even sold to other clients. So it was a really good experience, and to see that as a scientist, to see that the knowledge that we're researching on the brain, to actually see it happening, and saying, oh, this is actually the music network that's now engaged, and then all of a sudden this person emerges from being sort of locked in. And the same with art. And these are things that we don't really appreciate generally as a society, but these are incredibly important as part of being human. That has to really be maintained across the lifespan, because these are things that make us special, I think.
Yes.
Yes, if somebody has dementia, in music, visual arts from their past may bring them out. Is there any evidence that continuing to be creative as you get older, productively, may slow down dementia, just in the same way that, exercise, etc. may?
Yeah, so this was the data that we were seeing, in my own lab, that in fact your experience with music and your engagement in music was having an impact. And so this was any experience whatsoever over your whole life course had an impact on your late life brain health. So absolutely, the flip side of it is, even in sort of, preclinical or healthy trajectory, music has beneficial effects on cognition and also on brain structure and brain function. So yeah, absolutely.
But would you be able to sort out the chicken egg thing of, if an older adult remains creative, will that make their risk of dementia decrease? So not what they did as a child, but the whole thing of, if you take up knitting or you eat with your left hand, it's all these little things of doing something new.
Yeah.
But does continuing to partake in a creative lifestyle actually defer dementia onset?
Most of our data comes from cognitive engagement. So engaging in cognitively intricate or interesting activities. We have, I'd say, a good amount of data to support that impacts your risk of dementia and your late life brain health, as well as some of the social aspects of creating. So that's also extremely important, and there's a lot of data for that. In terms of the creative lifestyle, there's a lot less about it, but because it taps into such multifaceted behaviors, very complex human behaviors that engage with some of the things we know do help, specifically cognitive engagement, social engagement, it's very likely that will also be beneficial. I don't know of studies specifically looking at the creative lifestyle itself. But just breaking it down into different domains that have been studied, there's good evidence for its potential protection. Yeah.
Have you looked at the dose response curve of any of these activities? We all know that 7,000 steps per day is what's rooted or.
Oh yeah, that's so tricky. I just had a conversation about this with a statistician, and we were thinking of trying to build something that essentially does what you're describing, which is, taking data from the UK Biobank and trying to predict what people need, what is the dose that they need of exercise to make a difference. And so those calculators don't yet exist. Stay tuned. We might try to work on one. In that study that I referred to very briefly, the HABS intervention study, we did look at dose response curves, and we'll do some more modeling of that, looking at the impact of individuals who did engage physical activity on working memory, and we were able to see a dose response effect in our very short study. So in terms of larger scale calculators, stay tuned. In terms of a smaller study, that we do see a dose response effect. Judith.
About stage 2 made the push-ups. If we could see the evolution or demolition in the skill set, could the patient see it? Did they say
that's a great question? I don't know. There wasn't much writing about what the patient perceived. I think the patient was doing this to understand the illness themselves. So certainly they were perceiving changes over time. but the impact of that, or the emotional impact of that, I don't know. I'm sure that there was. So there's a phenomenon called anosognosia, which is loss of awareness. So usually early on in the course of a disease, patients and families come in, and we get a lot of important information from caregivers. And early on, it's the patient that's reporting a lot more symptoms and an awareness of what's happening. Later in the course, however, that dyad switches, so it becomes the caregiver that starts reporting, because the self-awareness can actually be impacted by some of the brain changes that are experienced with dementia, and that's called anosognosia, so a lack of awareness of one's own deficit. So it's a really difficult question, because I'm sure very early on in some of the more representational pieces, there was a strong awareness, and that was part of the motivation for that particular artist to create this series of portraits. But towards the end, I'm not sure, and it, the disease process itself typically does involve some component of change and self-awareness. Yes, Rebecca.
I didn't start thinking that I heard about the other end of the spectrum. I think so. So is there any research on intergenerational, like, living or learning that helps with dementia itself, like being a person?
Yeah, so that intervention study, I didn't go into the details, but that is an intergenerational intervention. And we have a study that we published earlier this year on a process called generativity. So this is the desire of someone, or the actions of someone, to give back to other generations. And we actually found that having increased generativity in late life, so a desire to help other generations, so younger generations, was associated with increased purpose in life. And we actually found some neural signatures of this very complex human behavior. And we harnessed that in order to design this intervention that actually looked at intergenerational engagement. And found that it seems to be very beneficial. So yeah, not the kids as much as the adults, but we were honing in on the older adults particularly. But there's some studies that have looked at the effect on the younger generation and found an impact, mostly in the context of education. Yeah.
So recognize that it is blue cell, where people live to be over 100 in Okinawa is one of them, and one of the main aspects that they said that allowed so many people to live to be over 100 was the purpose in life, what they call the ikigai in Japanese, and that the other factors, but that itself was perhaps the most important factor, ikigai, purpose in life.
Yeah, it's really interesting. I'm collaborating with Nancy Mayo right now, and she does a lot of work on active aging, and this intersection of purpose in life, which we had found in our research on intergenerational care, essentially, is extremely powerful. And it's some of the things that we don't ask in medicine. I mean, you don't go into a doctor's office and they don't ask you about your purpose in life, but in fact, it's extremely important that with things like mobility, are highly predictive of your cognitive abilities in late life. So there's a lot of blind spots that we currently have. Yeah.
I just have to, we're in the Gordon Smith Gallery, and so I just thought I'd just throw this one out there. I remember talking to Gordon once about that. He, of course, lived to be 100, and I was always so shocked that he remembered names. Like, he would remember someone he met once. And I'm terrible at names. I said, what's the secret to you remembering names? And he said, every night when I go to bed, I think about who I've met that day, and then I try to spell their names. I close my eyes and I try to spell their names backwards. Every night. I don't know if he was pulling one on me, but that's what he said. And I thought that's like a good app to have, It's like maybe preventative. He had very good memory.
This is an aside, but there's educational work that goes into like the more difficult something was to like encode or like do. So there was just some basic learning studies that are going like repeat a certain word twice, right? And then remember the set of 16 words that you've been given. but then they scramble the words up. So each one of these words are going to appear twice, somewhere randomly, repeat them all. And like the harder it was to do the thing, the better people get at remembering it. So I wonder if like creating that kind of challenge for himself at the end of the day is part of that, like making it harder to remember that person's name, so then I remember it better.
There's been some great research on this. You can talk about levels of processing. And a colleague of mine in Toronto, Fergus Craik, worked with Endel Tulving, who sort of developed this idea of episodic memory. So Fergus was really working on the more that you try and encode information, for example, the more likely you are to remember that. So the example you gave of Gordon Smith is exactly the kind of thing that Gus was looking at. So if you give somebody a word, but then ask them, is that word representing a living or a non-living thing, all of a sudden they remember that word. But if you just read the word and then walk away, you're not going to remember it. But if you try and do another level of processing on that, it gets encoded more deeply and can be remembered later on. So these are, you can call it tricks, or you can call it, this is just basically the way our memory works, that if we have a different way of encoding it, that tends to make the memory more persistent and useful for sometimes as well.
Implying that spelling a name backwards helps you remember it implies that you can remember the name 5 minutes after you've heard it.
That's the other problem as well, yes, exactly.
Because at the start you're talking about kind of social economic factors and education being one of the like driving forces for dementia. So how do you think working in medicine, you know, because when I think about being an artist, that's a different level of income mostly that people live if they're working as a full-time artist. So how do you think in medicine we can find a way to elevate the status of art between, you know, from physicians to physicians, to talking about it, to make it something that's more, like gives us more space in society to do those jobs?
Well, I think that in and of itself is, you know, the answer to the question that's being asked. I mean, you know, we need to make space for art in medicine and in all areas of life and our pursuits, because it enhances who we are as people. It enhances the pursuit of whatever it is we're trying to achieve. And so this is, you know, a very productive, inspiring, and important space that needs to be created and that we should hold. Thank you for that.
As I mentioned, I recently moved out here, and I've been here about 2.5 years. And my wife and I spend a lot of time on Vancouver Island as well, up in Ucluelet, on the sort of Tofino, Ucluelet area. We got to know some of the indigenous communities out there. And one of the things I found quite intriguing, but also motivating about their perception of things like art is in this particular group, the Ucluelet thought, they actually don't have a concept of art. For them, the creation of art is part of what you do. That's part of who you are. So there's no separation between art and something else. It's just basically part of being a person. And that's an interesting perspective, and that's hard to obviously westernize and embrace in our culture, but it's also a perspective I think that we can probably aspire towards, and thinking about creativity as being not a separate activity, but as being part of living. And if that's embedded in our thought processes, that actually makes art not so much art by itself, but actually something about being a person, is you're creative, and that's just natural.
How about dancing? Because the reason I'm asking, I'm Armenian, and the Armenians in villages in eastern Turkey that used to be Armenia, each village has its specific group dancing. And after people finished working, they would start dancing. And the people there are known to live very old, and they are wise even when they are over 90 and even 100. Dancing is, it is to show their emotions, and then being in a group kind of connects them together.
It's wonderful.
But I don't see any, like here in North America or in Western culture, is not that common.
There is a reputable study, the ballroom dancing. So I'm a Scottish country dancer, which is very complex, and we have to do these preformed, it's like square dancing, but the dances are pre-written. There's no evidence to show that Scottish country dancing prevents dementia. In fact, we can tell when people are becoming demented because they become less good at following the dance, and they get confused by the patterns. But ballroom dancing, where you're making up the patterns as you go along, has definitely been shown to be a brain saver. It's the only form of dancing that has actual scientific data.
So it depends on the music.
It's you're making up the dance as you go along, and it's you're working out where to go between people to navigate and the patterns. But Scottish country dancing, which you would think, remembering the pattern, pre-written, has absolutely no, at the moment, sadly, because she would like more people to Scottish country dance, but it has no evidence that it is a great saver.
Incredible.
So, here depends on who's leading. Touche.
Thank you so much for all your wonderful questions. I'm afraid we are out of time, but I wanted to thank our wonderful speakers today, Dr. Maiya Geddes, Dr. Randy McIntosh, and of course, thank all of you for coming.